3 weeks ago, I did an initial walkthrough video after I launched the Iowa COVID-19 tracker website and fully transitioned over from the original Google Doc. I have added in a number of new features since then and figured it would be a good idea to do a series of videos describing everything and helping Iowans to fully utilize everything the website has to offer in the way of data and information. When you come to the homepage, the first things you will see are the navigation bar and the massive header graphic. I will come back to the navigation bar in a little bit after I explain all the graphs and information on the homepage. First, as you scroll down, you will see when I get downloads and scraped data from the state of Iowa's COVID-19 website. Immediately following is the active infections graph. Early in the pandemic, I knew one of the main things I cared about was understanding how much infection was spreading in our communities. While Governor Reynolds was focused on tests completed and how many Iowans recovered, I wanted to know how many Iowans were affected at any given time and whether those Iowans were transmitting the virus to others. This graph is a simple calculation to determine that number of Iowans on any given day, namely, total positives minus the sum of total recoveries and total deaths. I do this calculation per county as well because while our state is as a whole is important, it's our communities that matter the most because most Iowans stay in our communities and only travel to see family in other communities. Below the graph is a blurb about how IDPH determines recovery status, the calculation for active infections, and the data cleanup that occurred on June 30th, 2020. The nice thing about all of the graphs on the Iowa COVID-19 tracker website is the ability to mouse over and see the values on any given day. Below the active infections graph is an interactive map of Iowa, divided into RMCC regions. When a county is hovered over with your mouse, it will pull up a pop-up box that contains the county name, population, and the local public health phone number. I suggest adding the phone number for your county to your phone's contact list, just in case any of us becomes exposed and our contact traced. That way we won't think it's a spam caller and ignore the call. Heck, I never even get within 50 feet of anyone outside my household and I have Story County Public Health in my contact list. As my son likes to say, better to be safe than dead. The next section is Statewide Snapshot. This table contains the 24-hour positivity percentage, 24-hour values for positives, recoveries, and deaths, as well as cumulative values for all the same metrics. At the end of the table is the statewide case fatality rate, which is calculated based on deaths divided by the sum of total recoveries and deaths. I have these same values for each county as well. The next section is how our state has trended for tests coming back positive since May 16th, 2020. I don't have values from before this, since this is when the state's website released recovery data. Technically, values from before May 16th are on that website, but they don't match with anything reported by IDPH, so the data is low quality. I would rather utilize what data I know is correct instead of basing calculations off data that may or may not be correct due to a lack of transparency. There are two important takeaways from this graph. First, our average positivity hasn't changed much since the middle of May. That's problematic since our tests per day have been moderately increasing over time. We are continuing to find many symptomatic positives, which is indicative of asymptomatic and subclinical positives not being found through testing and instead being able to spread the virus in our communities unknowingly. Second, the anomalous 22.87% value occurred on the day that Reynolds said there was a lab delay that caused a backlog in test process. I wish we had been given a better idea of how there was a lab delay. Our average positivity statewide on any given day is anywhere from 4% to 11%. Our cumulative positivity is hovering in the 9% range. Right below this graph is a blurb sourced from the World Health Organization that discusses what the positivity percentage should be in areas with extensive testing. If positivity is coming back over 5%, that means that testing is predominantly revealing symptomatic positives and that asymptomatic and subclinical positives are being missed, and that might be transmitting the virus in our communities. The next three graphs contain daily values for positives, deaths, recoveries, and tests for every 24 hours. As we can see on the recoveries graph, the outlier day when Reynolds declared that all Iowans who could not be contacted by public health were deemed recovered at 28 days skews the scaling for the values on any other given day in Iowa. Now for the logistic curves, which are my personal favorite because I'm a math nerd. The first graph is cumulative positives every 12 hours. While we should have a flattened curve now, similar to when the pandemic was in the slow growth phase in March, instead, we have a solidly growing linear increase. This is the opposite of flattening the curve. It's more like people just constantly spreading the virus at a transmission rate that continually replaces one sick person for one recovered person. Iowa has seen an uptick in daily positives in the last week, so we might be entering a new exponential growth phase. Cumulative deaths, like positives, also have a logistic curve. Since deaths lag behind positives by at least 1 to 4 weeks, the graphs for deaths are translated to the right. It also has an upper limit that is far lower than that for positives, since approximately 5% of positives experience disease so severe that they need hospital intervention. I will talk more about death rates in a video about pre-existing conditions, race, ethnicity, biological sex, and age groupings. Once again, we see that the recoveries graph contains the outlier day in June. The thing that strikes me as strange is the fact that while positives and deaths are logistic, Iowa's cumulative recoveries graph is linear. This doesn't pair with how the disease presents nor how it spreads. I've searched the internet and read multiple peer-reviewed publications on COVID-19, but none touch on what a recovery graph should look like. Intuitively, I would figure that it shouldn't be a perfect linear graph. I am bothered by this graph. Tests, on the other hand, should be linear, as Iowa has completed approximately the same number of tests every day since the middle of May. There are variations on any given day, but Reynolds has said that her goal was to have the system capable of processing 5,000 tests per day. It's important to note that this does not mean that 5,000 Iowans are tested every day, just that the infrastructure can handle that many tests. In comparison, Minnesota is processing about 13,000 tests per day, and Illinois is processing about 30,000 tests per day. Iowa is well behind the curve and not remotely on the ball when it comes to extensive testing. I started tracking testing itself at the beginning of the pandemic, since testing was hard to come by and there is a definite relationship between amount of testing and control of spread. In April and May, testing was growing exponentially as new testing and processing sites were coming online. On May 6th, that growth halted and turned linear. The second testing graph is a recreation of the percent change for positives graph on the state's website. It's not particularly helpful in my opinion. The last three graphs look at how COVID-19 infections and deaths compare to influenza-like illness and pneumonia, as well as how the state is reporting deaths to the Iowan public as compared to the CDC. Now back to the navigation bar at the top of the homepage. On the navigation bar, there are multiple options. The home drop-down menu contains all of the county web pages with graphs like those found on the homepage. LTC Outbreaks contains graphs for each long-term care facility that has been identified as having a cluster by the Iowa Department of Public Health. Iowa Hospitals and COVID-19 contains graphs for hospital and ventilator trends for each region and for the state as a whole. Demographics and COVID-19 contains graphs for all the demographics in Iowa, namely age groups, biological sex, race, and ethnicity. Health status and COVID-19 contains graphs and discussion for symptom presentation, pre-existing condition status, and how professions play a risk of becoming infected with COVID-19. Exponential growth contains a link to Omni Calculator, which has a COVID-19 susceptible infected recovered model based on values you can input. I have a table for these values by county, as well as at a statewide level. I will be updating these values on the last day of every month. That is my husband sneezing. This page will also contain any other important models and research that is particularly salient to Iowans. Data tables contains all the tables of data that I have collected from either the state of Iowa's website or from press releases by the Iowa Department of Public Health early in the pandemic. And finally, About COVID-19 Tracker is a small profile page about me, when I stream and download COVID-19 data from the state website, and links to articles and videos about the work that I am doing to help keep Iowans safe and informed.